So, but without further ado, let me introduce one of my dearest friends of all time. She actually changed my life 18 years ago. I used to travel around town and just go to all her little lectures and just learn from her and put my guests in front of her because she was always the most amazing person. But she really did teach me that I could live a different lifestyle and live to be a healthy old age person, which is coming closer all the time. You know what I'm saying? So, I mean, really, you have changed my life, Cheryl, for sure. I mean, it's unbelievable, but you have taught so many people over the years. So you can see here, she's a certified naturopathic doctor. She's been one for many years. I mean, I've known her for 18 years. She's a master herbalist, so she knows her stuff. She knows her compounds. She knows what she's talking about with products and what to use and how to use them. She's a sought out speaker. We miss her. We don't get to see her so much in person anymore. We yearn for the day that starts to happen again though, right? And she is also a naturopathic wellness coach. So yeah, so I'm so excited. And she also has a course that's not on here tonight, but normally you have that on there. But she also has a course that she developed that is an amazing course that she teaches other people. So I'm very excited to have you back, Cheryl. So I'm going to go ahead and let you just take it away and teach us all your good stuff tonight.
All right. Well, thank you, Lisa. It's always so much fun to do these and to just share with everybody education, because I'm a firm believer that your health has to come first in your life. You know, I mean, spiritually, God comes first, but your health, without your health, you have nothing. And when I was a young woman in the fitness industry, I didn't have good health. And so I appreciate it so much. Someone reached out and taught me, you know, led me to the right direction. So especially for you guests that are on and people that are just seeking out how to really bring your body into optimal health. That's what I'm all about, is helping you find the root cause of your health challenge and then apply natural solutions to find out and bring your body back into balance. And that's what my course is all about, is just teaching people how to find that root cause of what's going on. Because you know something that's really hit home to me lately that I want to just share with everybody before I do my disclosure. Actually, let me just share this from my heart, is that tonight we're going to talk about sinuses, we're going to talk about allergies and respiratory and asthma and things like that. But one thing I can tell you is that foundationally, inflammation is at the root of all disease. Inflammation. And the body has no fences. And it literally, when your body is inflamed, it can go to different areas, different organs, different tissues. Tonight we're going to talk about the sinuses being inflamed. But the root is inflammation. And so when we look at that way, it's going to help you to understand that, hey, I do have power over this. I can bring my body back to balance if I just work on getting the inflammation down and getting toxins out of my body. The body knows what to do when you give it the right tools. And that's what we're going to talk about tonight. So there's hope. You don't have to stay sick. All right. So I need to say this because my attorneys tell me I have to. I'm not here to, this is about my course, but anyway, it applies here. It's just I'm not here to treat, cure, diagnose anything. I'm here to give you education only about the human body. And, you always want to see your doctor if you have any questions about medications or whatever you're on. So now I want to talk about the body systems in relationship to how interconnected they are. And tonight we're going to talk about your respiratory system, which includes your sinuses, things like allergies, hay fever, those kind of things, which relates to your immune system, to a weakened immune system, which also relates back to the digestive system. So whenever I teach, I try to connect the body system so you understand that. This drawing has been around for years. I had a graphic artist make it, and I think it helps people to understand that what I'm trying to teach, which is there are no fences. So if your digestive tract is stagnant and you're not eliminating from the colon, okay, which by the way, my nickname is Dr. Poop, and you should be eliminating twice a day, at least minimum once a day, not like I did back years ago where it was twice every month, okay? And if you're not eliminating and the body is backing up, we're going to learn tonight how that affects your sinuses, all right? It can affect your liver because your liver processes everything. It's your filtering organ, and then it goes up the pipeline to the lymphatic system, which is your immune system. And we're going to learn about this, but just kind of see the drawing, and then it even affects the circulatory system. So the lymphatic system, okay, it contains proteins, fats, and other products of digestion, and it is interwoven with your gut. 60% of your lymph system is interwoven, somewhere between 60-70% is interwoven with your gut. And what it does is it helps with the absorption of fats. And the main job of it is to transport white blood cells, all right, to the body's main interior defense. So it's your immune system. Now, the other thing it does is it cleans up intercellular waste. There's another drawing I had done, my little Irby. Do you remember Irby, Lisa? Still have Irby around. But anyway, I love illustrations when I teach because it runs alongside of your circulatory system, and it acts like a little Pac-Man cleaning up intercellular waste. And so when the lymph system gets stagnant, if it's not moving well, then the lymph gets backed up. And one of the ways that the lymph system gets rid of its debris and waste, it traps things like bacteria and virus and all that, and it excretes it through the mucus channel, through the bowel. And when it gets backed up, that's when we have a problem. Now, one of the things that the lymph system does not have that the heart has, it has a pump. So the lymph needs movement. You have to get exercise, so vitally important to get a healthy immune system and get that lymphatic system moving. So if you're sedentary, that can affect your respiratory system and your immune. So you want to get exercise at least 3 to 4 times a week. Get out and move, whether it's walking, trampoline, biking, swimming, anything that you can do to move your lymph, all right? Now, this is a busy slide, but it's important for you to understand. Headaches, colds, earaches, sore throats, sinus problem. How many people have somebody you know that struggles with this several times a year or chronically? And that's the ones I want to talk to tonight. The lymph system eliminates its waste by secreting, okay, it's into the mucous membranes. So it pulls the waste out and it uses the mucous membranes, and then large amounts of the mucus are eliminated through the colon and the digestive tract. If the colon is backed up, then the mucus starts to be backed up, and slow transient time of waste material in the lymphatic system will basically back up. And now what the body does is says, wait a minute, I can't get rid of this toxic waste through the bowel. So it makes more mucus, okay? And now it's gonna find another cavity. It's gonna find the sinus cavity. So excess mucus starts to build up and gets toxic and irritating. And this can lead to a lot of chronic health challenges. That was my life prior to studying naturopathy. I was sick 8 to 10 times a year, and I had to go on antibiotics every single time because I got secondary infections. But what I'm going to teach you tonight is so valuable, because once I understood that it was connected to my gut and that it was caused by all the frequent use of antibiotics, I knew I was on the hot trail. So I started using herbs and break that antibiotic cycle, but I also started working with the colon and getting my bowel opened up. And then we're going to learn how to work with this. So here's a picture that really makes sense. Long-term solution improves digestion is cleaning the colon out, opening up the bowel where your bowel is really cleaned out, and your liver, okay? And so when you do this, you're going to, use a system that I call the 7-day detox system that is so powerful. But if you have any type of respiratory issues, it's really good to do a colon cleanse at least twice a year. But especially if you've been having chronic sinus conditions, it's a really good place to start, because it allows that lymphatic system to dump its waste and get rid of those mucus, that irritating toxic bacteria. So the 7-day cleanse is a simple program where it has a liver formula called hepatic cleanse, a release formula called, the little herbs that have things like Cascara sagrada in them that will stimulate the bowel a little bit to have more bowel movements. And yes, you want to maybe start this on the weekend. And then it has an added fiber that has L-glutamine, which is so powerful for your gut. And it also has a blend of a lot of fiber to bulk up the stool and really cleanse out that colon. Along with this, if you decide to do a cleanse, I highly recommend you get the NutriClean Aloe tablet because that's going to help that cleanse work even better. And it's a good thing to have on hand. So if you have those days where you're starting to be irregular, you can do an aloe tablet, and man, one tablet before bed and everything is starting to move along. So that's my Dr. Poop message for today. All right. So now what you want to understand about cleansing is it doesn't just work with the bowel. It works with your liver. It works with the gallbladder. It works with the circulatory system, and it works with that lymph system. And that's what I'm trying to hit on tonight with the connection with the lymph and the sinus and things that are really bothering the respiratory system. So the fact is, and these are old studies, but they're interesting, that there's a way overuse of antibiotics. Between the years of 1993 and 2005, that's a long time ago, but look at this, that the number of Americans hospitalized due to antibiotic-resistant superbugs, or MRSA, okay, skyrocketed from 2000 to 370,000 people. That's amazing, okay, of the hospitalization from these resistant superbugs. Currently, MRSA and other antibiotic-resistant infections kill about 60,000 Americans annually because we're overusing antibiotics. We're not getting to the root cause of why people need them. We're not getting the immune system built up. We're not getting the inflammation down. And so this is a scary thing. And it's something that you can take control of. So another thing that happens to the sinus cavity, we're all familiar with a thing called candida or yeast infections. But you know what happens is that when our friendly bacteria gets out of balance, we should have 80% friendly bacteria and 20% unfriendly. But the American diet, with all the sugar, the stress, the use of antibiotics, that gets reversed. And when that gets reversed, we get a situation where yeast and fungus likes to hang out in moist cavities. What is your sinuses? It's a moist cavity, okay? So these mucous membranes, okay, like in your mouth, your intestines, your nasal area, and a woman's vagina, this is where they like to hang out. So in order to get this under control, we need to recognize that we need to build up our friendly bacteria. So that's the other key point that I want to bring out. Open the colon, get the bowel movement going. Now replenish the friendly bacteria, because if you've got chronic sinus conditions, I'd be willing to bet that we have an imbalance of friendly bacteria, and it's going to show up as, I call them yeasty bugs, but it will hang out in the mucus layer. So what you want to do is you want to inoculate yourself with a good dose of probiotics, even for maybe a month or two, doing 10,000 to maybe even doubling that 2 times. Like you can do 10,000 IUs, which I'm going to show you one in a moment, that's 10 different strands, and you could double that for a month or 2. If you have chronic sinus conditions and you're like, I really need to hear this because I am so tired of sinus pressure and recurrent sinus infections. So this is a real key here. And the 2 most studied probiotics are lactobacillus and bifidobacteria. And there are approximately 30 species of the bifidobacteria and 50 species of the lactobacilli. But these are broad spectrum, and they really work to get your body back into balance and suppress that yeast situation. So the one that I love is enteric coated. It is beautifully made because it won't open up in the stomach. It's going to wait till it gets down into the small intestines and the large intestines, and where it's going to start populating. And these bugs stay alive in the bottle and in the GI tract. And they've been clinically studied to survive a very, very harsh stomach acid. But it has 10 billion units, 10 strands. A lot of the ones you're getting at the health food store are not high enough, and they're not made in the right way so that they're going to get down where they need to go and populate. My favorite time of day to do these is right before bed, even though the bottle says in the morning. I know we have our nurse practitioner, Tina Rose, on with me, and she agrees with that. And it's really been a life changer for me, Tina, since I switched. My whole system is working better. I love it. I love it. And I'm so consistent with it. You know, it's just like, I wouldn't even think of going to bed without doing my probiotic. It's like wonderful, right? All right, So now we're going to go into the respiratory system, a little deeper dive to understand it so we can get, and again, this is coming back to what I just taught you, but I think people need to hear it a couple different ways. The congestion of the lymphatic system leads to the congestion of the respiratory system, whether you've got asthma, whether you have sinus conditions, anything with your respiratory. In the Chinese medicine, strong connection between the colon and the lungs. Under normal conditions, the lymphatic system will dump its debris in the form of mucus into the bowel. But when the bowel begins to get sluggish, okay, then the lymphatic system will empty its waste into the lungs instead of the bowel. So we talked about sinus, but now we've got chest congestion, okay? And again, that can be affected by the unhealthy digestive tract. So, all right, so keep going. So, over-the-counter cold and remedies suppress, okay, interfering with the production of mucus and the expellation. They push it back in the body. And they also come with a whole host of side effects like dry mouth, dizziness, headaches, high blood pressure. These are not really helping you. They may short-term give you a slight bit of relief, but it's not getting to the root of the problem, okay? So what most herbal remedies do is they help to expel the mucus. They break it up, they get it loosened, okay? And they're decongestants and they're natural antihistamines. And that's really what we want. We want to get the body fighting against those bad bugs and get the immune system up and then be able to break up the mucus and get it out. 1 in 3, okay, people suffer from allergies, okay, which is an overreaction where the immune system is overreacting to maybe pollen or dust or animal hair. And these mast cells, basically they release a hormone called histamine. And histamine triggers like what everybody experiences, like sneezing, nasal congestion, coughing, wheezing, itchiness in the eyes and the bronchioles and swelling and all that. That is a weakened immune system, okay? So if we're gonna get to the root of the problem, we have to boost the immune system. You can't just constantly take a medication and say, I'm okay, I'm taking an antihistamine over the counter. You're not getting to the root. All right, so now here's a formula that I really, really like that is it's an ingredient in a formula called OPC3 that I'm going to talk about in a moment, but I want to talk to you about some of the studies on pycnogenol because it's very powerful. According to the study of pycnogenol was found to inhibit the release of histamine from mast cells that were aggravated by an irritant, and their anti-inflammatory inhibits production of the pro-inflammatory mediators, which relieves swelling and making breathing easier. And that's what you want. When you're dealing with asthma, you want to get the inflammation down, reduce the swelling in the bronchi, reduce the swelling in the sinus cavity, and have a natural antihistamine so you're not so sensitive to that pollen or whatever it is. Now, this picture is kind of interesting. When you look at an asthmatic person, their bronchial tubes tighten and thicken and they get inflamed, and the mucus is filled, making it very difficult to get the air, okay, get your air into the bronchi and the villi. Where in a normal person, they're open, there's no congestion, there's no swelling and all of that. So we have to look at why people can't breathe, and that's what's going on. So before I go into formulas now, I want to tell you as a naturopath that I've researched for years different herbal compounds. I'm always trying to stay up on what's going on, but it really matters what you take and how it's formulated, because a lot of the health food stores or GNC or the different stores that you're going to, they're selling a lot of advertising, and you may not be breaking those things down. So if you're a guest tonight and you've never heard of Isotonix, I'm here to tell you I found this when I was looking for IV therapy for patients years ago, looking for a way to boost their immune system. I had some serious conditions like lupus and hepatitis C and cancer, and I was literally looking for a clinic to send them to get an IV therapy. When I discovered this formula called Isotonix, and the way they work, they're a powder. When you mix it with water, they become the same osmolarity of your bodily fluids, so you don't have to digest them. And that is a deal breaker. The stomach doesn't have to break it down. Unlike a tablet, which you should take with food, these isotonics will trigger the pyloric valve, and in 5 minutes they're going in with no digestion needed, and they're pushing into the lumen so that you're getting full absorption, around 90% bioavailability. Unlike a tablet that might take 40 minutes to 4 hours, if it's a good one, there's some great tablets on the market, okay? And I recommend some of them. But isotonic is still superior. If you could get something in isotonic, you're going to get a higher absorption rate. But some things like herbals and things like that, you just can't put in isotonic, so we take them in a different bioavailable format. I showed you this picture just so you guys understand. It's not just that it's liquid like you're drinking orange juice. The isotonics have an ability, they have potassium, and they have, because they're the same osmolarity as the bodily fluids, they have the ability to push through the mucus layer of the small intestines, so it's driving whatever formulas you're taking into the bloodstream, and that's why it works so effectively. It's way better than just taking a liquid herbal tincture or formula like that. And what you don't want to do is take vitamins that you're pooping out. And these are x-rays. That is exactly what's happening. And so the older we get, the less hydrochloric acid we have. We need to be very concerned and do our homework. Don't invest in vitamins that you're just having expensive poop or urine, okay? So what I want to go back to now is a formula called OPC3. And this is a very, very potent antioxidant. And it has the ability to be a major anti-inflammatory and major antihistamine. Those are the 2 points that I'm talking about tonight. But along with it, you may be a sufferer of sinus condition, allergies, asthma, but you also maybe have joint issues. You may also be struggling with other inflammatory markers in the body, because like I said earlier, inflammation knows no fences. If you have inflammation in your sinuses, I'd be willing to bet there are other inflamed parts of the body. And what OPC3 does is it's clinically studied to lower inflammation, even in a clinical trial, lowering C-reactive proteins by 52%. So it's so powerful. But for tonight, let's dive in how it works with more like asthma and sinus conditions. So in pignogenal.com, you can go and pull up the full study. But they took children, childhood asthma, researchers found that 60 children aged 6 to 18 with mild to moderate asthma were able to significantly reduce and discontinue their use of rescue inhalers when they supplemented with pignogenol, whereas as the placebo experienced no benefit at all. And then pignogenol also, with its antioxidant capability, it's very strong with this anti-inflammatory, so it soothes the irritation that caused bronchial to swell. So it works in 2 methods, okay? Breaking the antihistamine cycle and reducing the swelling and the inflammation, making it easier to breathe. And the inhaled steroids deplete the body of calcium. That's something that's a big note there. So if you know someone that is taking, corticosteroids or, inhaled steroids, that depletes the body of both calcium and folic acid, which are your B vitamins, which is kind of an oxymoron, because also asthma patients do really well with absorbing Bs because that helps to relax the bronchi, all right? Now, the other thing about OPC3 in the study, and this is just a graph, how it showed that they had easier breathing with hay fever and asthma. So you can see with the baseline here with the placebo, and then up to 71% more effective, easier breathing with pignogenol. And then another study that, I guess that was the last one I had. There's several more, but go to pignogenal.com and you can pull the full studies up on this. It really is impressive. Now, this isotonic formula is the only company that carries pignogenol in isotonic format. And along with it, it has another host of really great things for your immune system, like grapeseed extract, red wine extract, and then, of course, the pignogenol and bilberry extract, and citrus extract. And, of course, citrus is very good for colds and respiratory issues as well. There's a lot of studies on that. So to dive a little deeper into chronic sinusitis, okay, it's considered chronic when it lasts more than 12 weeks. So we've all experienced a cold. They're very uncomfortable. The body will handle it. It'll break it up and expel it, right? But it's when it gets chronic that I'm talking about tonight, that I'm going to teach you some things that you can do that I think will be very, very beneficial to you. So you also have to have at least 2 of the following. And what most people complain with chronic sinusitis is it hurts to the touch. The head hurts. The pressure is so great. And they a lot of times will get a hardened, trapped mucus where it's not breaking up. And it will cause a lot of face discomfort and a lot of fatigue as well. It almost feels like you have a cold, but you really don't. It's gone into sinusitis, right? So the product I want to talk about now that I am so in love with, because I myself have struggled a bit with some sinus conditions, and I'll share my story here in a moment, but I want to talk about the ability of bromelain. Bromelain has been recognized to be safe and therapeutic, and it is used by individuals worldwide for a number of agents such as bronchitis, sinusitis, arthritis, and basically inflammation throughout the body. And it's the inner part of the pineapple plant that we take and we concentrate in getting this precious bromelain agent that actually acts as an enzyme, okay? So bromelain seems to produce, it fights pain and swelling. And what it does is it actually works with breaking up mucus, is the way it works, with a proteolytic activity. So you know how when you take protein or like pineapple and you eat too much of it, your tongue starts to swell and it gets little bumps on it. Has anybody ever had that happen? I went to Hawaii and I ate so much pineapple and my tongue just got raw, okay? Well, bromelain, that's the proteolytic activity of bromelain. And what I found in my research was so cool. In less than an hour of ingestion of bromelain, it's going to work. In less than an hour, which is so cool, okay? And so it also interferes with growth of tumor cells and slows blood clotting. So it has a whole lot more host of benefits, and it's effective as a natural painkiller as well, for things like arthritis pain and things like that it's used for. So here's some of the scientific literature of the things that bromelain has been used for. But I want to give you my story about my sinus infection. So my mom passed away a few years ago, and I had, like most people, I was very attached to my mother, and I really got sick. I cried and cried and cried, and my sinuses must have gotten so irritated that my immune system came crashing down, and I got really, really sick. Lisa even remembers this. And it was so bad that I hate to get descriptive, but I'm going to. I had like literally green mucus coming out of my ear. It was bad. It was really bad. And I finally broke down. I don't like antibiotics at all, but I tried all my remedies. I went to a doctor and I did get on some antibiotics, and they were really strong ones. He's like, I'm afraid you're going to lose your hearing. So against all of my teachings, I'm like, all right, I don't want to lose my hearing. I'll buckle down. I'll get my probiotics back in the game once I'm done with it. I did eventually get over it, sort of, but the mucus stayed trapped in my sinuses, and I was miserable. And every time there was a climate change, I was miserable again. I thought, oh my Lord, I'm getting sick again. It was so much pressure. I can't even tell you how painful it was. I went back to my doctor. She's like, I don't know, maybe we should do another antibiotic. I'm like, that is really not the answer, okay? So all of a sudden I'm going back, it's the teacher has to teach themselves. I'm like, what is going on with my body? And again, you always hear me talking about be a detective, figure out what your body's saying to you. And what had happened, I had stripped again all my friendly bacteria with that very, very strong antibiotic. And I really didn't do long enough on my inoculation phase of the friendly bacteria. So that was key number 1. So I started really adding in the friendly bacteria heavily every day. And then I started using bromelain. And literally the first day, within a couple of hours, when I was having major sinus pressure, within a couple of hours of taking the 3 caps of bromelain, I started to feel the mucus breaking up. I started to feel this swelling coming down in my head. I was like, ooh. I was so grateful, because if you ever live with this, it is a miserable lifestyle. So I was just thrilled with it, and I just can't brag about it enough. But definitely bromelain works. We have a lot of plastic surgeons that use bromelain for healing of scars and healing. So it has a lot of powerful properties to it. It also helps with breaking down fibrins that often lead to blood clots, and it helps with scarring. That's why plastic surgeons use it. And it assists to break down of proteins formed during inflammation. So this is a very, very useful thing to use after surgery, but also anyone that is trying to, even a cancer patient, there's a lot of research of how it actually works with the metastasizing of cancer cells. So here's your product, very affordable. It comes in a large bottle, 3 caps a day on an empty stomach. So I highly recommend this along with OPC3, and of course, getting that GI tract opened up and populating the friendly bacteria. And the next one I want to talk about is the B complex, because a lot of asthmatic people suffer with low levels of B, especially the medications they've been on, and your B complex, especially your activated B complex, can really help with the bronchi and relaxing the bronchi. So that's something that has been well researched. So I love B vitamins because we need them. We're all doing too much sugar, too much alcohol, under stress. Everybody should be on a B vitamin, but especially those that are respiratory with lung. This is very, very important to your regimen. And then, of course, vitamin C. I'm not going to spend time. I think most people understand the power of vitamin C, but it does come in isotonic. I recommend at least 1,000 milligrams a day, especially if you've got sinus or respiratory issues. I think that's a really good thing to add to it. And then vitamin D. I always have to throw our vitamin D in. There's major research on vitamin D deficiencies can cause respiratory disease such as asthma, I see my typo there, sinusitis, allergic rhinitis, and influenza. And I have an audio and a video on my YouTube channel, a long one and a short one, on vitamin D, on how vitamin D is so important, not just for bone health, but especially for your immune. Without vitamin D, we can't modulate our adaptive and our innate immune cells. They need vitamin D for those B cells and T cells to work effectively. And vitamin D boosts the ability of the white blood cells to go after those bacteria and viruses. So keeping your vitamin D levels up are so important. A lack of vitamin D causes cytotoxic T cells to fail at fighting infection, and T cells need the vitamin D to become active. So if you are someone that is suffering with allergies and that means you have a weakened immune system. So to build the immune, we want that vitamin D levels up to 50 to 70 nanograms at minimum, okay? And this is just another quote here. It's critical for the immune system. It has been linked to the decrease in lung function, which may affect your body's ability to fight respiratory infections. And again, most naturopaths and integrated practitioners now want it between 50 to 70 is like your normal range. If you want to be more medicinal, you can bump it up to 70 to 100. Like if you're a cancer survivor or you have an autoimmune disease, I would highly, highly recommend, or you're really chronically got a lot of sinus and immune response, it's a good idea. It won't hurt you to get that up. The one that I recommend is the isotonic vitamin D with K2. And the reason that this is so effective is K2 is like the traffic cop. It tells the calcium to go into your bones. When you're getting vitamin D up, you'll be able to absorb more of your calcium. And I listened to Dr. Zimbrowski, which is one of my favorite practitioners, and he was saying he's never seen anybody with calcification yet. And he uses 10,000 IUs very often with his patients. So I'm not really concerned, but the K2 is very important because you want that to bring the calcium into your bones and not into the soft tissue. That's a hot topic right now in nutrition. And this is just explaining how K2, a visual for you, if you have adequate amounts of K2, the calcium will go into the bones. If you have low levels of K, the calcium may go into your soft blood vessels. So that's why we include the K2 in our formula. And then last but not least, I want to talk about one more formula for boosting the immune. This was talked quite a bit about in a product symposium I just attended. If some of you guys attended, it was great. And Dr. Zimbrowski also talked, and this is something I believe in strongly, is beta-glucans. Beta-glucans are your own body's natural defense against, well, it builds glutathione, and glutathione is produced in your liver, and beta glucans have the ability to stimulate the white blood cells to go after viruses and bacteria. And so it comes from two sources. It comes from mushrooms and it comes from yeast. And so I'm going to talk about one that comes from yeast called Wellmune, but there's been extensive research for over 30 years of how using beta glucans, cancer patients, all kinds of research, but especially when we talk about our allergy sufferers. So what these beta glucans do, and these immune cells do, or these yeasts do, is they have what we call a complement that flags a chemical scent. And I always kind of explain it, it's kind of like taking a rag and waving in front of a hound dog that is after a bad guy. That's what the Wellmune will do. It will let your white blood cells know where the bacteria are. It complements it, and then the white blood cells say, better go get them. So it enhances your immune system. So this is just a visual. This is a white blood cell. This is a bacteria or virus. And in this video, you're seeing how it won't lose the scent. It's on it. It's not going to let it go. And so that's what beta glucans do. It makes that white blood cell more aggressive. And that's what we want, you know, especially in times like this when we're all concerned about our immune system. So Wellmune is something that is really got a lot of clinical studies, which I'm going to show you here in a moment. Hang on a second. Oh, my video keeps wanting to go. All right. So there's been over 9 clinical studies with this Wellmune, okay? And this is a patented formulation, and with respiratory health, cold, flus, allergies. And this is not something you just take like one time when you get a respiratory thing. You want to get on this and stay on this, especially during flu and cold season. But these are just some of the studies. The marathon study Wellmune reduced 40% of upper respiratory tract infections with 182 runners. Allergy studies, 48 healthy subjects. Wellmune provided relief to ragweed allergy sufferers, 27% reduction in average allergy symptoms, and 52% reduction in the severity of symptoms. So that's exciting. So here's your formula. 1 cap a day is sufficient, and you can mix that in with your other formulas. And so what I'm going to do now is I'm just going to end this with many of us on the call love our Isotonix. And what I'm showing you now is what we call the Daily Essentials that has the OPC in it. It also has the B. Everyone should be on a multi, and really everyone should be on a calcium with magnesium. So these are one of the things, if you were come to talk to me or talk to Tina and you'd say, well, where do I start? This is what we're going to put you on. We're going to put you on the Daily Essentials because it's complete, and it takes care of a lot of what's missing in the American diet. And again, with OPC3, you're going to load up on that, especially if you're fighting any type of sinus thing. But that's a 90-day serving in there, and you're going to save $26 when you buy it as a kit. So I highly recommend that. And then the other, for people that are on the go, we love these Daily Essential packets. They're fantastic, and they have 1 dose of OPC3. But now if you are fighting some allergies and you're in allergy season, I would give you more than 1 dose of OPC3. So I would actually, if you buy this, buy an extra bottle of OPC3 and take an extra cap in the morning and maybe even an extra cap or 2 before bed, depending on your body weight, all right? And then you're going to add your bromelain and other things that I've just talked about.